Welcome to Marney's Minutes, where I share my advice, lessons learned, and best practices on various topics. Today's topic, consulting with the MedTech industry, where to begin conversations, and what does this process look like? Now, I'm going to caveat this. My personal experience was when I left sales and went into medical education and marketing, and so I was in charge of helping develop, curate, and work with surgeons that we brought in for consulting, and then moving over to another mid-sized company where I basically developed a program from the ground up and I identified the faculty that I wanted to work with. And so once again, bringing on surgeon faculty. I also help run a nonprofit on the side, and every year we do a dinner program where we teach early career surgeons about the nuances of how to get noticed and how to work with industry. And so having conversations with various MedTech leaders, this is where I'm coming from. Now, I'm also most likely going to be more applicable to if you're going to work for those larger companies. So not the startups. They have a very different process. In all transparency, I don't know about the startup MedTech process to bring you on. And so that's a different conversation. Okay, so we've gone through AdvaMed. We've identified that some of the company initiatives that the products that you use align with your care pathways, with your surgical approaches, and overall with your viewpoint on how to approach the procedure. So the conversations, we always say start with your sales rep. This is the person that you spend the most time with. And so discussing with them, hey, I understand your company is focused on X, Y, or Z. That's also something that I'm very excited about and comfortable with. Do you think there's an opportunity for me to maybe talk with someone in either medical education or marketing? I'd really like to get involved. Unless you are a very tenured physician, you've been in practice for a while, and you come up with something that, quite frankly, is very unique, the chances of you getting put on a design team as your first contract are very minimal. So do what I call starting small, which is where you want to either get brought on for some sales training, where you come in and you help the new training classes or at the annual sales meeting, or training your peers, which is where you're either giving didactics or you're doing labs, depending on what you're teaching. So here's the biggest thing to understand. This is going to be a long dance. They are going to send in most likely the sales lead to have a conversation with you to really understand more about your practice. Then you will hopefully meet with someone from marketing, medical education, or professional education sometimes they call it prof ed. And that's going to be a sit down dinner. They may come and they may see you in surgery, especially if it's a specific technique that they're thinking of bringing you on to teach. Now, have great conversations. Ask a lot about that person, about that company's initiative, about who else is teaching. If there's anyone else in your region or in your subspecialty or even at your hospital that's also teaching, are they considering a lot of new consultants for this? Or is this specifically for an individual program, either a lab or a series of didactics? Really understand what they're looking for and share with them what your big picture vision is. Now, I highly suggest you don't dump a ton of ideas. I would just say, I understand that you're going to need to see how I do in these situations. Would love to start out, whether that's a webinar, a podcast. Many of the big companies are doing podcasts. Put me in a lab as one of the supportive roles at a cadaveric station, or even just put me in a rapid fire where I'm sitting on a panel. They're going to want to see how you do. They're going to want to see how the process is in terms of being responsive during this, especially if you have a slide deck that you have to get in. They're going to want to see if you get that into them on time and if you adhere to a lot of the regulations that they've shared with you that's required to come on board and be a consultant for them. This is basically like the dating stage. Be on your best behavior, be polite, be very prompt, and be responsive. Just remember that there are hundreds of surgeons out there in your subspecialty, most likely doing similar things that they could fill in your place. And so think of it as an honor to be selected. And once you get your foot in the door, that's when you can really start to ramp things up. Once you enjoy your experience with them and they have a great learning experience with you. So that's how you begin the conversations. When we talk about the time frame, this could be anything as quick as a 2 to 3 month period this could take anywhere from 6 to 12 months. I also know that there are some companies out there that cannot even go through the entire process where they get your CV, they have a fair market value analysis run to see what your hourly rate would be and bring you on, unless they can work with you anywhere from 3 to 5 times for the rest of that year. That's key, mostly because, quite frankly, it's a lot of work on their end to bring you on, and you have to do a lot of training and go through a lot of conversations. So, unless it's just the barest way to get your foot in the door, do you really want to come in for a one-off invitation where there's nothing following up? So, those are my nuances and tips on how to begin the conversations and what that process looks like. Thanks for watching Marney's Minutes. If you found today's topic useful, don't forget to like the video and subscribe to my channel.